Next up is a presentation from Jessie Singer. Jessie is a journalist whose writing appears in the Washington Post, The Atlantic, The Nation, Bloomberg News, BuzzFeed, The Village Voice, Bicycling Magazine, The Hairpan, The All, New York Magazine, The Guardian, and elsewhere. Jessie is an expert in safe systems, injury prevention, and the ongoing rise in traffic fatalities, drug overdoses, falls, and other areas of injury-related death. Jessie studied journalism at the Arthur L. Carter School of Journalism at New York University and under the wing of the late investigative journalist Wayne Barrett. Please welcome Jessie Singer.
Hello, thank you all for having me here today. You can see my slides okay? Wonderful. Great. My name is Jessie Singer, and I'm a journalist and the author of a new book published by Simon & Schuster called There Are No Accidents, The Deadly Rise of Injury and Disaster. Who profits and who pays the price? I was also raised in Middlesex County, so I'm especially pleased to be speaking with you all here today. The book is a critical examination of the word accident and what we take it to mean. It examines the history of accidental death and injury in the US, as well as the current catastrophic rise in accidental death. And accidental death has been rising and rising in the US since 1992. And what we mean by accidental death in this case is a broad classification, also known as unintentional injury death. This includes deaths from fires, drownings, drug overdoses, falls, traffic crashes, and a lot more. In the US, these deaths have been rising since 1992 and have risen 132% in that time. And traffic crashes, what we're here to talk about today, are a big part of the problem. After decades of decline, traffic deaths have been rising in the US for over a decade, from 35,000 in 2010 to 42,000 in 2020. The steepest rises have been seen among pedestrians and cyclists. And as transportation professionals in the face of such tragedy, I think it's easy to feel powerless, but I'm here to assure you that you're not. And perhaps the simplest proof is this. While accidental death at large and traffic fatalities in specific are on the rise in the US, this is not happening in other wealthy countries. In fact, accidental deaths in general and traffic fatalities in specific are declining in our peer nations. So what's going on? Why here and not there? Big picture, we can track the rise of accidental death to deregulation and the dismantling of the social safety net. As regulatory agencies are defunded, we are all less protected from danger in our cars, in our homes, and in our workplaces. And as the social safety net is dismantled, our roads and public places are in worse repair at the same time that the average American has less money in their pocket. And that means they're more likely to live in a home they know is a fire trap, or take a more dangerous job that pays better, or drive an older, less safe car. We can see this reflected in specific ways in the rise of traffic fatalities. For example, NHTSA is passing fewer vehicle safety standards. Without regulation, vehicles are getting larger and heavier. Towns and cities are struggling to pay for road repair and much less what is actually needed, which is road redesign. Cities are repopulating, rural hospitals are closing, people are driving older cars for longer. This is a list of what I would call dangerous conditions. However, you'll note that the list did not include items like people are more distracted than they used to be, or there's been a rise in social deviance in the pandemic. I would call those not dangerous conditions, but human errors. This is a very important distinction. Human errors are not listed among the causes of the rise in traffic fatalities because the only way to systemically control the outcomes of human errors is by controlling the conditions that people are exposed to. For example, to slip is a human error. Water left on the floor is a dangerous condition. To leave the stove unattended, that's a human error. An apartment building without sprinklers is a dangerous condition. To exceed the speed limit is a human error. A road designed to encourage you to exceed the speed limit, that is a dangerous condition. Consider this. We know that drivers slow down on roads that are more narrow. They do not do this because they saw a billboard telling them to or because they're worried about the safety of other people. They do this for selfish reasons. They do this because driving fast on a narrow road feels unsafe for them. So when you know about a speeding problem on a local road, do you tell the police to chase down all the speeders or put up a billboard? Or do you narrow the road? If you want to be effective, you do the latter. But in the US, we're much more likely to do the former. And this is largely ineffective at combating the traffic fatality crisis because the police response or the billboard response is a way to focus on individual behavior. It's a way to say the road is fine. This one person is the problem. However, this response leaves in place the dangerous condition. In this case, a too wide road that induces error, namely speeding. The truth is that people make mistakes, and human error is part of almost every traffic crash. However, if instead of trying to perfect those mistake-making people, we focus on the systemic dangerous conditions which are in our control and which turn human error into a death sentence, we can actually affect outcomes. The truth is that often on the road, people are making mistakes that you or I would have made, just as they did, because there was no other choice. If we focus on human error after accidents, what one person did wrong, that's where we end up. But if we care about changing the death toll, we need to refocus on dangerous conditions because this is how we make system-wide change. Safety professionals across industries have long debated these ideas, and they have come to define the two sides of the human error dangerous conditions debate as the bad apple theory and the new view. That is, the old theory that a few bad apples cause accidents, or the new view that if people are making mistakes and getting hurt, it indicates that conditions are unsafe. So let's break this down. For subscribers to the bad apple theory, the purpose of investigating an accident is to find the human error and then assign blame to whoever made a mistake. Once whoever is in charge assigns blame and hands out punishment, they can consider the accident solved. For subscribers to the new view, the purpose of investigating an accident is to identify the dangerous conditions that caused people to get hurt when someone made a mistake. Once the dangerous conditions are identified, they can be changed. This could prevent the accident from occurring again, or it could simply reduce the likelihood of death or injury when another person inevitably makes the same mistake. So if you think that accidental death is caused by human error and bad apples, then to prevent accidents, you'd argue that we must fix people, which is quite a challenging proposition. But if you take the new view that accidental death occurs under dangerous conditions, then to prevent accidents, you'd argue that we must fix the environment. I am firmly in the latter camp, and I think you should be too, because as much as we pretend otherwise, we have decades of experience proving that human behavior is not really in our control. Hell, if you're a person who has ever set a New Year's resolution and broken it, you've got proof that even your own human behavior is not entirely in your control. But we can control the environment. We are in control of the conditions that people are exposed to. And that is all we need to prevent accidental death. Accidents happen when errors occur under dangerous conditions, but you can create conditions that anticipate errors and make those mistakes less of a life or death equation. There's no shortage of examples of responding to traffic fatalities as a bad apple problem. This is where the phrase, the nut behind the wheel, comes from, which the older folks among us might have heard. It also is the urge to respond to a systemic traffic safety problem, like the fact that people are prone to speeding, with scolding billboards and police enforcement, rather than an attitude that accepts that certain road designs induce fast driving and employing systemic measures that would reduce the dangerous conditions at hand, such as a traffic calming road diet. So one common example of the bad apple theory in traffic safety is this often repeated myth. 90% of traffic fatalities are caused by human error. I'm sure you've heard this. The truth is that this is a misinterpretation of a study that found that when examining the very last thing that went wrong just before a crash, human error was more common than, say, a broken traffic light or a wet road. It's not the cause of the crash, the study stated, but the last thing that went wrong in the causal chain. It's important to note that this stat has since been avowed by the National Transportation Safety Board and the World Health Organization. Another more recent example of the bad apple theory in traffic safety is the idea that the current rise in traffic fatalities is being caused by pandemic-related anger or social deviance. I'd like to debunk this for you. First, pandemic-related anger or social deviance is largely immeasurable. Second, traffic fatalities have been rising for a decade or 8 years before the pandemic. Third, the rise in traffic fatalities has not been seen in other wealthy countries. It's only happening here, despite a pandemic happening everywhere. And fourth, and perhaps most importantly, this conclusion is wholly unactionable. If you conclude that the rise in traffic fatalities is a byproduct of the pandemic, there's nothing you as transportation professionals can do. But if you say traffic fatalities are rising and I can change the conditions that are allowing people to die, I can change what they're exposed to, then there's so much you can do. James Reason's Swiss cheese model provides a helpful way to understand this. Our transportation system has layers of safety. The government regulation of vehicles, road design standards, infrastructure funding, emergency medical care, to name a few. Today, many of these systems of safety have been shot full of holes. There are holes in our regulatory system, our hospital coverage, our roads. And through these holes, failures sneak through, cascading until what results is a so-called accident. If we see a traffic crash as caused by human error or bad apples, say one driver who chooses to speed, we miss all the information in those layers of Swiss cheese. Understanding layered causality in traffic crashes allows us to see how one speeding driver is actually the result of wide roads that induce speeding and vehicles that have the capability to go from 0 to 60 in 3 seconds, and speed limits set by the 85th percentile speed instead of relative to safety concerns, and much, much more. And once we start to recognize these holes, we can learn how to patch them. You can see this model in the hierarchy of controls. This is an OSHA graphic. This is how we approach workplace safety, which notably we're far more effective at than road safety. This is because much of our approach to traffic safety is still stuck at the bottom of the pyramid, the least effective controls, the ones focused on controlling behavior, not conditions, and on rooting out bad apples, rather than reducing harm for everyone, even people who make errors. In traffic safety, we spend a huge amount of time and energy in the administrative controls section of the pyramid, attempting to change the way that people drive, walk, and bike through education and enforcement, instead of changing the conditions in the environment where they drive and walk and bike. This may be hard to hear, but the truth is that we have limited evidence that education campaigns and police traffic enforcement are effective tools to combat traffic fatalities wholesale, especially when we compare it to interventions that change the built environment. If you think about this logically, it makes sense. Say you see a new billboard that says speeding kills. You're not an idiot. It's very likely that this is information you already know. Will it change your behavior? Probably not. Will you even remember it a moment later? Think back to every broken New Year's resolution you've ever had. Those were behaviors you wanted to change, whereas speeding benefits you. It saves time. Why would a billboard you may notice once change a lifelong, personally beneficial habit? And say you speed to work 5 days a week, past that billboard, and one day a police officer pulls you over. What message does that send? It's not, I better change my behavior, because that officer only caught you 1 day out of 5. Rather, the message is, I had bad luck today and good luck 4 days. I bet my luck will be good again tomorrow. And as a side note, this is actually why automated enforcement does save lives. Where random or intermittent police enforcement plays on our sense of luck and unfairness, automated enforcement is a guaranteed every time consequence. And that does elicit a behavioral response. I want to be real with you. It makes sense that we turn to these so-called administrative controls. By contrast, changing the built environment, changing dangerous conditions, that requires special planning, special budgets, special efforts, but it also saves lives. There's another reason that we cling to the idea that traffic fatalities are a matter of correctable human error. The bad apple approach is psychologically satisfying. Look, if someone dies and you decide that the problem was one bad apple, then it says the system is fine. It's just a few bad people who are the problem. And after the seemingly random horror of a traffic crash, the idea that the problem is just one person is deeply comforting, but it's also incorrect. So what is to be done instead? I say this: stop trying to perfect people's behavior on the road. Instead, accept that people are selfish, accept that people will want to bend the rules, and design an environment that's safe for them, just as they are. Automatic fire sprinklers are a great way to understand this. Automatic fire sprinklers don't tell people not to smoke or punish them for playing with matches. Sprinklers prevent the harm of an accident, even if you're a bad apple. So in traffic, what does this look like? The answer starts with a focus on the built environment. The only holistic answer to traffic safety problems is controlling dangerous conditions. And luckily, there are a million ways to do this. There are so many holes in the Swiss cheese that you can patch. You can narrow local roads known for speeding with curb extensions, so drivers don't feel safe exceeding the speed limit. You can install raised crosswalks and daylighting and leading pedestrian intervals at intersections, so pedestrians and cyclists are better seen. You can create separated biking and walking paths that prevent any potentially harmful interaction between people and cars. You can expand public transportation options because people on the bus are far less likely to be killed or to kill someone in traffic. And the availability of public transit directly reduces DUIs. You can add crosswalks where people are already crossing the street, not only where the MUTCD says you should. You can elevate NACDO street design standards over the MUTCD as they're far more evidence-based. You can pass legislation to legalize automated enforcement and to lower speed limits to 20 miles an hour. You can install safety devices on the city and county fleets that are in your control, such as speed governors on city vehicles, side guards on garbage trucks, driver monitoring systems, lane change detection, and automatic emergency braking on every vehicle in your fleet. All of this is evidence-based and proven to work. And all of this protects people, regardless of human error, even if they're a bad apple. All of this changes the built environment, removes dangerous conditions, or protects from them, even if people make a mistake. If you're thinking, we can't afford this, I understand. I'd also say this. Often government initiatives focus on reaching the most people. And this is how we end up with billboard campaigns that reach thousands to little measurable effect. Instead, I would say, spend those limited dollars focused on reaching the most needful. Make a decision to reach fewer people, but to be more effective. Sure, a billboard can educate 1,000 people to questionable results, but if you use those same funds to redesign even one intersection, you will definitely reach fewer people, and you'll be guaranteed to actually save lives. And here in your own backyard, you have a remarkable example. The city of Hoboken hasn't had a traffic fatality in 4 years. That is unseen most everywhere else in the country. And they did this by changing the design of their streets and in simple, affordable ways. You can do this in your city or town too. In closing, I would encourage you to look out for the bad apple theory responses that appear to traffic safety problems in your community, and to ask the hard questions when those human error-focused solutions arrive. Like, will punishing one person or 10 people solve this problem deep into the future? How can we design this road to assume that people won't read a billboard, but they will make bad decisions? How can we reduce the harm here, even when people make mistakes? I'm full of faith if you start with these questions, you'll end up on the right track. That's all from me, but if anyone wants to connect after this is over, my information's on the slide. Thank you so much for having me.